So the British Society for Haematology Lymphoma Special Interest Group, which I'm fortunate enough to currently chair, organised a session about focusing on what's new and the questions that we all get asked because we often get confused or we don't know the answers. And so we had three fantastic speakers within this session. Professor Emmanuel Bashi came to talk to us about should we be autoing our patients up front with T-cell lymphoma. And there's a lot of debate about this in the lymphoma community. I think that the data are very mixed. We don't have good prospective data, so we're looking at retrospective data and all of the caveats of this. And he discussed with us the trial which is being led by Lisa, a randomized trial which may hopefully give us the answer and is a fantastic trial. I thought it was really interesting that at the end we asked the attendees what they thought about autoing in T-cell, because there was this population and country bias, and about 70% of UK attendees are still in favour of auto for their patients up front. Another talk that we had was Professor Daphne de Jong talking about the pathology and the classification of lymphomas. We know there's been some changes recently, and she did a really fantastic, clear presentation, not only telling us of any changes, but also how we relate this into our clinical practice. And then the final talk was from Efia Yasmin, which was a really helpful talk. She's a fertility specialist, and she gave us a lot of information about how we can and when we should try and achieve fertility preservations for our younger women or girls who are requiring treatment for lymphoma. So she talked about oocyte preservation, ovarian tissue preservation, and how we should go about trying to access this for our patients, what tests we need to do. So I have to say, I think that the Lymphoma SIG session was really helpful.